What if the first sign of cancer was already sitting in the routine blood test and we missed it? Most people associate cancers with complex scans and biopsies, but sometimes subtle clues may appear much earlier in something as simple as blood test. To help us understand better, I'm delighted to welcome Dr. Shanaz Khodaiji from PD Hinduja Hospital, an expert in laboratory medicine and diagnostics. Hello, Dr. Shanaz. Welcome to the podcast Diagnosis Matters. So, my first question to you is that when people hear the word cancer, we often think of complicated tests or scans, but from the laboratory perspective, can simple blood test also detect this disease?
Yes, definitely. A simple blood test can give clues to some cancers, but not all cancers. So, the most commonly asked test in any laboratory is the complete blood count, which is popularly known as the CBC, and this measures all components of the blood. Now, the components of the blood are the cellular components and the plasma. So, we in hematology measure, or in the CBC measure, only the cellular components. The cellular components of blood are the red blood cells, which carry oxygen to all the different organs of the body, the white blood cells, which fight infection, and the platelets, which help in clotting. Now, if there is a cancer of any one of these cells, all these cells are produced in the bone marrow. So, the bone marrow will start producing abnormal cells, and you can easily see abnormal cells in the marrow. However, there are certain cancers of the blood and bone marrow itself, such as lymphomas and multiple myelomas, which cannot be detected early in the CBC. And there are a whole lot of other cancers, such as the solid organ tumors, which do not show up a complete blood count. So, for these, we have certain other simple blood tests also, such as the tumor markers. As you must have heard of the PSA, the prostate specific antigen, which detects prostate cancers, the CA-125 for ovarian cancers, or the CEA for colorectal cancers. And additionally, also, if the clinician is suspecting cancer, say in the liver, you can do liver function tests or you can do kidney function tests. However, all these tests are non-specific. They are just clues. They are not diagnostic of cancer. So none of these tests will give you an answer whether the patient has cancer or not, and you will have to definitely go in for further testing. So depending on the clinical features of the patient, the age of the patient, the clinicians will see, or we as laboratory doctors or pathologists also look at our parameters and we further advise. If we see, supposing a kind of an abnormal cell in the peripheral blood, then we advise further investigation. Similarly, the clinicians will advise either in some imaging modalities such as an ultrasound or CT and MRI, or most importantly, if the cancer is in the organs, then you have to do a biopsy where the tissue is taken from the organ and examined by a pathologist under the microscope.
Absolutely, that's fascinating, ma'am. So, ma'am, patients, when they usually look at their report, they just see the values between the normal reference range. But when in a lab, a pathologist looks at a report, learns it in a deeper way. So, what do you generally focus on?
Yeah, so we as pathologists don't look at single values, we look at trends. For example, we look at certain unexplained or unexpected results. So, for instance, as I already told you, the cellular components of the blood are the RBCs, the WBCs, and the platelets. Now, if all three of them, one, two, or even all three of them go down, then these are called cytopenias. When all three go down, it's called pancytopenia. Now, pancytopenia is something that occurs in a wide variety of conditions. So, the commonest cause for pancytopenia in our country is vitamin B12 deficiency. And the other causes are more sinister, such as myelodysplastic syndromes, aplastic anemia, both of which are precancerous conditions. So what we do is we look at the trend in these, like earlier it was normal and then it came down. Supposing we see that the patient, so we always correlate with the patient if the patient doesn't look healthy, or we can also correlate it with the CBC findings, in which a vitamin B12 deficiency can have a macrocytic picture. So based on that, we advise further testing. Then, of course, you can have, like, say, abnormal liver function test, abnormal kidney function test. So you see a high WBC count can either mean the patient has infection or the patient has a leukemia. So we have to can't just see the count in isolation. We have to see the patient. We have to see other parameters of the patient as well. Now, whether the patient has abnormal cells or whether the patient only has normal cells and the count is high, that would indicate an infection. We see liver function tests, kidney function tests. We collaborate with tumor markers. We see the ESR and the CRP, which are just inflammatory markers, but they are increased in both infection and in inflammation and cancers. So, and we sometimes, a patient comes with just hypercalcemia. Now, hypercalcemia is an indicator of many tumors, or even if the patient has not been diagnosed, but you just see a hypercalcemia, you may want to further test the patient for other conditions.
Right. So it's very interesting to see actually how the study of these deep patterns, influence the test.
So we don't, as I said, the patient might see just one parameter and panic, but we don't. We see the whole, like, you can see a pancytopenia and think you have an aplastic anemia, but you have to see whether you first rule out a B12 deficiency.
Absolutely. So a deeper study gives a much more better insight. So, ma'am, many a times patients also experience anxiety when they see an abnormal lab report, including me. I feel very anxious. So, not always an abnormal lab report means that there is something serious. So, how do you differentiate between a harmless variation and a real red flag?
Yeah, so that's a really good question, because sometimes patients just see a single value and they start panicking. But we see a trend, a pattern, and we look at the report in the two contexts. We also correlate clinical findings of the patient. We see the persistence of the lab findings. We see the pattern of the lab findings. So sometimes if the variation is just mild, then you will not worry. But, or you will repeat the test, or you will do another test for down the line, say 4 weeks later, to see that it is not becoming worse, and or it is even improving with some medication. But there are sometimes when the deviations are severe and marked, then you get worried. Then you have to definitely follow up more stringently with the patient, and not allow the patient to get away, or sometimes patients don't come back to you, so you have to
you have to make sure that
make sure that they understand the severity of their condition. And and as I told you, we always correlate. We never see a lab report in isolation. We always correlate with the patient's symptoms. So if there are unexplained symptoms such as fever without any cause, or night sweats, and unexplained weight loss when the patient is not expecting weight loss, all these kind of conditions will make us take more cognizance of the abnormal values. So when we are seeing the reports, it's in as a package, as and no one abnormal value, the patient does not need to panic. The patient should always go back to the doctor and discuss with the doctor, and that will put him or her more at ease as to whether it is really a symptom to be so concerned about, or whether something that is going to improve, and that they should not worry about it.
Definitely, that's very reassuring that it's not just abnormal results, but also correlation with the clinical
and also
symptoms.
sometimes patients go a lot on Google and try to find an isolated finding, which is will give them an answer which is certainly not the right one, and take them into a different place altogether. So preferable to avoid that, and the simpler thing would be to consult a specialist.
That sounds great. So many people, when they do a blood test, they just do it like once and then they forget about it totally until they do a next health checkup. But doctors always emphasize on periodic checkups. So how important do you feel is looking at the trends in the report, these patterns, and how regularly they should be done?
Yes. So as I already said, trends are extremely important to us. So what we look for in any abnormality in a patient is just reiterating what I've already said, is persistence of the abnormality, progression, whether it remains the same or it progresses, and whether it's explained or unexplained. Now, for example, if a hemoglobin, as I told you already, is just mildly low, we just wait for it. We look at the next blood test. If it is the same or it's come up, then we forget about it. But if the hemoglobin is low and after 3 months going down persistently low, then we have to do a further investigation.
Right.
Similarly, a WBC count, if it is high, it can be due to an infection, or as I said, due to some more serious conditions like leukemias and other blood cancers. So if you give an antibiotic, you treat the patient and you see that the patient has improved after some period of time, then it's fine. Otherwise, you have to investigate further. So trends are very important.
Right. So a report, it could be just like a snapshot, but
Absolutely.
I think a periodic health checkup.
Or trends are like a video.
Trends, correct.
A report is like a snapshot.
Absolutely. Thanks so much for this. Yeah. So, ma'am, people generally ask this question that are the blood test, can they detect all type of blood cancers rather than the solid tumors? And if yes, so why is that the case?
Yes, so definitely blood tests like CBC give definite answers in blood cancers, in blood leukemia, which are called leukemias. However, they don't always pick up the solid organ tumors, and this is because, or as I told you, the blood cells are all formed in the bone marrow and they come straight. Actually, we consider blood as a liquid organ of the body. It's one of the organs of the body. It's an organ system where the immature cells are made in the bone marrow and they come out in the peripheral blood. So all leukemias arise in the bone marrow, come out in the peripheral blood, and can be easily detected. So when we see when we do a CBC, we get a clue as to the count is very high, or the hemoglobin and platelets are low and WBC count is high. So all kinds of permutations and combinations we find. So when we do that, immediately we are alerted to the fact that this patient might be having some blood cancer. So the first thing we do is look at the smear. We make a blood smear and look at it under the microscope, and 99% of the times we pick up a blood cancer on that. And based on that, we advise further testing, like the bone marrow, and then we have the immunophenotyping and all the molecular markers that we have for leukemias. We advise all of that. So that is because all these cells are very easily seen in the blood. Now, there are other tumors, even like lymphoma, which is actually a cancer of the blood forming cells, but it originates and forms in the lymph nodes, and multiple myeloma, which is in the spine. So both these also are not readily picked up in the blood.
Right.
However, when in the later stages, when these both diseases progress, some of the cells might come out in the peripheral blood. Likewise, in solid organ tumors, because the tumors are all forming and developing and growing in their own organs, they are not readily picked up in the blood. So therefore, the take-home message here is that a normal blood test does not rule out all cancers.
Right.
If you have a blood cancer and it's abnormal, it will show, but all the other cancers will not show.
It clearly shows that where CBC plays a role and
absolutely,
where the other tests do.
Absolutely.
So, doctor, now you talked about conditions like leukemia or blood cancers. So, how early you think that the CBC can show up something which probably even the patient is not showing symptoms, but CBC has shown the leukemia or other blood cancers specifically?
Yeah. So imagine you're a perfectly healthy person. You're going in, just because you want to do a blood test, or you're going for a health check.
Routine checkup,
And sometimes, even without knowing you're healthy, you have no symptoms, and the blood test can show a leukemia. So leukemia especially, leukemias basically are of two types: acute leukemias, which are have a worse prognosis, which are more progress fast, and there are chronic leukemias which are very indolent and slow growing. So the acute leukemias, you can see them in the CBC some time before the symptoms can develop, or you may be having something like a fever or a persistent sore throat and you don't think much of it and you don't get a blood test done. But if it persists and the doctor tells you go and get a blood test done, sometimes you're not really unwell but just for that one symptom, so you can pick up. And the slower growing leukemias, the chronic leukemias such as chronic lymphocytic leukemia, chronic myeloid leukemia can be present in the blood for quite a while before you can pick them up, and many times they are just incidentally picked up in a routine blood test. I have picked up many chronic lymphocytic leukemias in regular health check patients.
Right, and the patients didn't literally have any symptoms.
Any inkling, didn't know anything at all about it. The count was raised, the lymphocyte count was raised, and we just diagnosed that and asked them to undergo further investigation.
Right. So a random CBC report, a random health checkup done, and these was
that is the importance of doing a health check and a CBC that
Correct.
you can pick up.
Correct.
However, as I already told you, lymphomas cannot be picked up in the early stages. Multiple myeloma cannot be picked up in the early stages, and solid organ tumors cannot be picked up in the early stages. But you will get clues such as lowering of hemoglobin, lowering of platelets. The patients progressively become weaker. And then you always correlate with the clinical symptoms.
Right.
So it is very necessary to do that, because you can pick up leukemias much earlier, and therefore the earlier you start treatment, the better the prognosis. And conversely also, every abnormal CBC does not mean that it is a leukemia. You can have an abnormal CBC due to infection, inflammation, certain dehydration, many conditions like that.
So modern laboratories today are using highly advanced automated analyzers, which are detecting a lot of parameters in details. So you think automation has really helped to diagnose these subtle abnormalities, which otherwise may have been missed?
Of course, if you look at laboratories today, automation has vastly changed the way we look at all our test results. Now, earlier a CBC used to only give us few parameters, and now the automated machines generate far more parameters than we can even see on our CBC report, and these are called the advanced cellular parameters. And this is because the analyzer is measuring tens of thousands of cells and generating data on all the cells, and generating all different types of data like shape of the cell, size of the cell, and we yet have not researched all these parameters to see of what use they can be, but some parameters have definitely been researched and have found to be very, very useful to us. So like, apart from all the CBC parameters like the hemoglobin, the WBC count, platelet, and the differential, etc., these automated analyzers use very advanced technology, of fluorescence flow cytometry, light scattering, impedance technology to generate all these parameters. And some of the parameters that they generate are very useful, like there is a parameter called the immature granulocyte. So whenever there is anything abnormal in a analyzer, they raise flags. So if you see a flag and an IP message comes, immature granulocytes, because you are seeing only 100 cells in the microscope, you may not pick up that immature granulocyte. But because of the fact that the analyzer is analyzing so many more cells, even very small populations, subtle populations can be picked up by the analyzer, and it will give you a flag saying there is immature granulocytes. So you look at the slide more clearly to look at the immature granulocytes, which might be only due to an infection, it may be due to a leukemia. So this is how they increase our awareness and enhance our ability to diagnose things better. Then you have many other newer parameters. You have the whole reticulocyte profile. The reticulocyte count is, the reticulocytes are the very young RBCs which are being generated in the bone marrow. If the reticulocyte count is high, it means your bone marrow is normal, it is functioning properly. Your red blood cells have gone down due to any reason, maybe hemolysis, which is breakdown of the red blood cells, or hemorrhage. If you're hemorrhaging, your volume of the red blood cells will go down. So your bone marrow increases the production of reticulocytes so that they come out in the blood to help make more blood, more RBCs. However, apart from the count of the reticulocytes, you have certain other parameters like the reticulocyte hemoglobin. And this is a very, very early indicator of iron deficiency anemia, much earlier than many of the conventional parameters that we are using these days. So a reticulocyte hemoglobin, if it's low, you can always get a ferritin of that patient done. The serum ferritin is the iron stores of the body. If your the hemoglobin may be normal, but the reticulocyte hemoglobin is low and the ferritin is low, you can start prophylactically start the patient on iron therapy. So Then there are platelet parameters, as you know, which are very useful
Yes.
now. One is the fluorescence platelet,
Yes.
or the optical platelet counting, which is far more accurate than the impedance counting that we do. And then there is a newer parameter called the IPF, or the immature platelet fraction, which again shows you, if it is high, it shows you platelets are being formed in the marrow, but for some reason they are being destroyed. That is why they are low in the peripheral blood. So you don't have to rush to do a bone marrow. Now, earlier, when children, mostly this condition ITP with low platelets, common in children. And earlier, when children had this, we used to go do a bone marrow in each one of them to see that megakaryocytes are there or not. But now we don't need to. We do the IPF, and if it is high, we know that the bone marrow is producing platelets. So all these newer parameters on the CBC analyzers have greatly enhanced our ability to diagnose and to become aware of many smaller nuances and changes in the CBC.
So right from the modality of the treatment to actually maintaining a good recovery period to even before that diagnosis, I think the entire capability of a laboratory
is completely changed.
Absolutely.
Exactly.
So, ma'am, before we conclude, I'm sure many people watching us today must be thinking about their own health report. So, what is it that you would want to tell them that when they look at their own health record and they see something abnormal, what is the first thing that they should do?
See, the first thing I would say is that don't try to interpret these reports in isolation. Don't panic, because many people panic. That is of no help. Instead, take the report back to the person who has advised you to do the test, or sometimes patients do a health checkup. So go and see whoever doctor you're comfortable with, but seek medical guidance, and don't try to interpret this report in isolation, because that you are not qualified enough to be able to come to the right conclusion.
Absolutely, absolutely. And finally, Dr. Shanaz, one simple message what you would like to give our audience when it comes to routine blood test and cancer awareness.
So, one message that I would like to give the audience is that regular blood tests are not about detecting the disease, it's about staying ahead of the disease. So, it's very necessary that you go for regular checkups so that any impending disease can be detected much earlier, and your treatment, if it starts early, can be of definite benefit to you. So, what I would like to say is that go for regular checkups, follow up on all abnormal test results. Most importantly, if you get a single abnormal test result, don't panic, stay cool, meet your doctor, and I think you'll be fine with that.
Thank you so much, Dr. Shanaz, for giving your valuable inputs and on diseases as important as cancer, spreading awareness about it, and talking about blood tests, routine blood tests, which are so very important. Thank you for the wonderful session and giving your valuable inputs. Thank you so much once again.
Thank you. Thank you very much.
What we heard is an important reminder. Simple blood tests may not always diagnose cancer, but they sometimes provide early warning signals. Your blood report may be more powerful than you think. Don't ignore it. If you found this episode insightful, do like, share, and subscribe, because greater awareness about routine tests and early warning signs can make a life saving difference. Until next time, stay curious, stay informed.